We are following breaking news here on your 5 News at 6. A CDC advisory panel has given approval for the Pfizer vaccine to go into the arms of children as young as 5. Thanks for joining us. I'm Erica Thomas. During its presentation with the advisory panel, Pfizer says the child-sized version of the vaccine is 90% effective against symptomatic infection. The dose is just a third of what people 12 and older currently get. Several major pharmacy chains have said they're already gearing up to get the vaccine out to children within a matter of days if the CDC director signs off, and that could happen as soon as tonight. Now, this breaking news would make around 271,000 Arkansas children eligible for the pediatric dose of the vaccine, but is the state prepared to distribute it? 5 News reporter Micah Wilson is live in Rogers, and he asked the governor about this during his weekly news conference. Micah?
Is ready and set to go. Now, they have a plan to distribute the vaccine, and they already have started ordering doses.
We will receive nearly 110,000 doses in the initial wave. So there is more than enough vaccine available for children here in the first wave of vaccination.
Hutchison says doses of the pediatric vaccine will be distributed and administered following approval from the CDC director.
It would be immediately available. And so it would just be a matter as soon as they could make an appointment.
But first, at local health units, there is one located in each county. From there, it will be available at vaccine for children providers, then at Arkansas pharmacies. The governor pushing for vaccines, but he says he doesn't plan on mandating them.
This is something that is a parental decision for their children. We encourage it. We encourage that discussion. And to get the right information, to talk to your physician.
Pediatrician Joel Fankhauser recommends the vaccine for immunocompromised children. He says, in general, vaccinated kids are best for public health.
But we know for a fact that it decreased the likelihood that children get symptomatic COVID at all, which decreases the risk of transmission.
And to reduce the transmission rate, the governor is hoping schools help out by providing clinics.
The Department of Health will support them in hosting a clinic. And we expect that to happen, and we encourage that to happen. We want to do everything we can to make it as available as possible.
He's glad that these vaccines are available for children because in our state, seeing recent data that's showing that we are seeing an increase in hospitalizations in cases for kids of that elementary age of 5 to 11. We're live in Rogers, covering news where you live. Mike Wilson, 5 News.
All right, Micah, thanks. The governor also says he hopes to see the same trend in vaccination rates like he did for kids 12 to 18. He says as of now, 50% of that age group is vaccinated.